Well, hello everyone, and thank you very much for joining us today. My name is David Wortley. I'm the Virtual Conferences Director at IORMA. I'd just like to say a few things about IORMA and a bit of housekeeping before we get underway. The IORMA Consumer Commerce Centre, it's a neutral resource for businesses and governments that recognise the need to understand and respond to the ways in which the 8 billion global consumers are changing in the products and services they want and need and the way they want to obtain them. And these changes are happening globally, driven by developments in society, in business, and in technology. And the topics that are chosen from IORMA's Horizon Scanning, its surveys, and its research. Now, it's my pleasure to be moderator for this event today. We have a fantastic group of panelists, and I'm going to bring them up on screen individually now and ask them to briefly introduce themselves. So I'm going to begin with Dr. Noel Kelly. Dr. Kelly. Noel.
Good afternoon, everybody. Lovely to see you all here. My name is Noel Kelly. I'm a Medical Director for Spirit Health, which is a healthcare company that also uses digital technology for remote patient monitoring. Previous to this, I have a long history of working within the National Health Service as both a frontline clinician as also a strategic leader. Thank you for inviting me today, David.
Thank you very much, Noel. And now Dr. Subhashini. Subha.
Hi, thank you for everyone for joining. My name is Suba. I'm the Director of Science, Health and Wellness at Holland & Barrett. Holland & Barrett is a high street retailer of 150-year heritage, and we are involved in offering health to the high street through products like vitamin supplements as well as digital offering. I also used to be a practicing clinician in my background, and I have previously worked in insurance and sit on a board of an NHS trust as the Wellbeing Guardian as well. Thank you.
Thank you, Suba. And now Dr. Dimple Devadas. Dimple.
Hi, good afternoon, everyone. So I'm an NHS doctor. I'm also a psychological coach, leadership, creativity, and I'm also a social impact engagement artist. I have a number of roles, including at the British Society of Lifestyle Medicine and the Department of Health and Social Care.
Thank you very much, Dimple. And last but not least, Dr. John Sykes. John.
Yeah, thanks for having me, David. Good to see everyone today. So I'm a GP partner working in the Bath Eastern area, just outside of Bath. I'm one of the trustees of the British Society of Lifestyle Medicine and a fellow of the Australasian Society of Lifestyle Medicine, implementing lifestyle medicine within the NHS, but also do it through other avenues as well. I worked in Australia for a period, doing a clinic out there around this topic. And yeah, looking forward to talking to you more about it today.
Okay, thank you very much for John. Just a little bit of background about this session, which is aimed really at providing some useful information and advice both to employers and employees on preventative healthcare, how to keep yourself healthy and productive for as long as possible in your lives. And the panelists that have been chosen today have a background in this. Now, we've all been affected in one way or another by the impact of coronavirus. And what COVID has done has accelerated a lot of implementation of digital technologies, mostly for helping people to work remotely. But the technologies that are being developed today are also extremely useful for helping us to remain healthy, both physically and mentally. And just by way of an introduction to the session, my interest in this whole topic began about 9 years ago, not because I was unhealthy, although I was pre-diabetic, but I decided to explore the potential of wearables to see if I could improve on in particular, my obesity and my risk of getting diabetes too. So I started with a wearable device some 9 years ago and started walking 5 miles a day. And within 3 months, I'd lost 21 kilos. And that indicated to me the benefits of this kind of approach. But it has very many different aspects. You'll hear a lot about lifestyle medicine in this session, as well as the technologies that are being used. I'd like to now just go on to lifestyle medicine and what that is about and the value of exercise. And to do this, I'm going to play a short video that was supplied to me by Dr. Sykes. It's a cartoon, and it tells of some of the benefits of physical exercise.
Hi, I'm Dr. Mike Evans. Now, I think most of us know that exercise is good for you, which is true. But another big reason to be active that we don't often talk about is productivity. When we begin our day and think we only have so many hours and so much on our to-do list, it seems counterintuitive to fill up part of the day with doing something other than working. Well, the data shows this thinking is wrong. The data shows regular exercise is part of your job. And by exercise, I don't necessarily mean going to the gym for an hour. As little as 10 minutes of activity counts, and you can do it just about anywhere, like getting off the bus to stop early, walking to lunch, having a walking meeting, walking while on the phone, or taking the stairs. Okay, let's dig a little deeper into the science. Let's start with a group that are marked on their achievement every year, our kids. Many recent reviews have shown that increased physical activity improves cognitive performance and academic achievement. Not to mention when we follow kids for other issues that affect productivity, so self-esteem, anxiety, depression levels, sense of social well-being, all of these improve with activity.
Well, that gives a little bit of an introduction, John. Can you kind of fill in a little bit? Tell us how you actually got involved in the British Society of Lifestyle Medicine, what lifestyle medicine is about, and how you apply that to yourself and your patients.
Yeah, of course. Yeah. So essentially, I was very interested in sports and exercise medicine, and I found myself going to conferences and learning more about the subject. And I found that I was always tending towards talks that were talking about the benefits of physical activity. And when you delve into the science, when you look at the research, when you look at the evidence that we have that supports physical activity being beneficial in reducing the risk of disease, reducing the kind of outcomes of disease and the kind of symptoms which are associated with disease, and in some cases even reversing disease processes, the evidence is overwhelming for a number of different conditions, from heart disease to lung disease to types of cancers such as breast cancer and colon cancer, as well as depression, anxiety, even dementia. Huge reductions in risk from just being physically active. So I found myself being more and more interested in that. I've also got an interest in nutrition and a few other areas within that lifestyle realm. And I found just gradually over time, I was building up those building blocks in those areas. And that led me to a position where I came across the British Society of Lifestyle Medicine, found myself very drawn to the way that they were pushing the message. And that's where I've kind of ended up one of the trustees. For me, lifestyle medicine is for everyone, and it's got huge potential. The key thing about lifestyle medicine is that it's evidence-based and that it suggests supporting behavior change through person-centered techniques in order to help people improve mental well-being, physical well-being, sleep habits, nutrition habits, and just overall health patterns. So even things like substance avoidance, those kind of things. So it has to be evidence-based, involve behavior change, and work on those key lifestyle pillars. For me, physical activity is a really, really big one, but there are loads of other ones as well. And one of the reasons why I think this is so relevant to the topic today is that actually the element of lifestyle medicine, which really appeals to me as well, is that we've seen from multiple studies that quality of life, as well as just productivity, is very much related to an individual's sense of purpose, as well as their level of social connectedness. And I think this also really plays into a role in terms of our work patterns. Working as a GP partner, I've been involved with trying to push some of the lifestyle messages within the surgery. I've done that as a partner, but also previously in my other role as a salaried GP. One of the things we did was a physical activity challenge where we got individual members of the surgery to group up as teams. We gave everyone names and essentially got people being active and over a period of time monitored that. And we were able to increase activity in members of the surgery by about 60%. But way more than that, what we found is that this increased camaraderie within the surgery, it increased connectedness within the surgery, and morale and things like that were just so much higher than they usually had been. And it was to a certain extent related to this project and the way that that kind of encouraged that interaction. And we found that was actually probably a bigger factor than anything. And there's no doubt that as a result of that, we felt like a more well-functioning practice. And I think we got better results during those times when we were able to do that. And that's just a small example of things that you can do, say, with your staff. But in terms of actual lifestyle medicine change with our patients, that's also where we can make huge changes. And it's great to have this conversation around technologies as well, because I think that's an area that's really developing too.
Okay, thank you very much for that, John. I'm now going to move on to Dimple, Dimple Devidas, and I'm going to play an extract of a video that Dimple sent to me, and it's about the British Society of Lifestyle Medicine. It'll just be the first 60 seconds or so, which will tell you just a little bit about what the British Society of Lifestyle Medicine is.
waxaan u taaganahay caafimaad waxaan u taaganahay caafimaad adiga dartaa aniga iyo anaga dhulka dartiisa dhammaan u wada jira waxaan u taaganahay caafimaad
So, Dimple, it's only a very short part of a 5-minute video, but it kind of brings out the importance of some aspects to mental health. So tell us something about your work and the kind of things that you feel are important to helping people with their physical and mental health and well-being.
Yes, thank you very much, David. Yeah, so that film really was to highlight community and relationships, and it was a collective crowd film. So the BSLM members were asked to take a 1-minute clip of things that they were doing in their families, in their everyday life, at work, in their communities, to be healthy and well. A lot of my work is to do with engaging people, behavioral change through creative and social impact activities. And the first thing you can do is create time for that reflection, whether it's meditation, whether it's good nutrition, and all of them are vital for mental health, for spiritual and emotional health. And a lot of my work looks at how we can do that as communities, as families, as organizations, and that's really important step, whether you are an employee or a employer. So one of the things that I'm looking at really is building psychologically safe environments and cultures, and that includes building trust, looking at leaders' attachment styles, and looking at actually bringing in these diverse and inclusive environments. And what can you do as a employer to create that psychological safe environment? And we know that psychological safety as a construct is a critical driver of whether it's innovation, healthy group dynamics, interpersonal relationships, and human motivational theory. So self-determination theory by Deci and Ryan state that we're motivated by relatedness, our relationships, competence, and autonomy. And this is really important so that we can then provide environments for learning, health, growth, collaboration, and innovation. And who wouldn't want that at any point in time? And that's really what my focus is about.
can I just ask a supplementary question? When you come to changing people's lifestyle behaviours, what sort of barriers have you come across that if you like stand in the way of people improving their personal health?
Yeah, good question. So many barriers, and actually some of them are perceived barriers. So it could be things like pain, it could be certain symptoms like breathlessness, fatigue, other things like stigma and confidence, other things, motivation is quite common, but nowadays things like costs and capability as well. People are not sure. So go back to self-determination and motivation theory. What are the three things that people need to change behavior? So that is capability, relatedness, and autonomy. And some of these perceived barriers could be self-defense mechanisms. So it's really looking at how gently having these conversations and using psychological behavioral change techniques to really open up the conversations and get people to think about how they can change their behavior. But also our urban environment affects the way we live, and these behaviors cannot just be changed by just individuals. So we need, whether it's policy with like councils and government, urban planning, also policies in the workplace is so important to really support behavioral change. So it's really important that people go away from these tokenistic tick box exercises to embedding cultures and group environments that support healthy relationships and behavioral practices. And that starts with leaders actually modeling this.
Okay, thanks very much for that, Dimple. I'm going to move on now to Suba, Dr. Subashimi, and I'm going to ask her about a couple of things. One is, we see these adverts from people like Vitality Life offering smartwatches and wearable devices to encourage them. I'd like you just to say something about that and what the experience of the effectiveness of that approach is from a business point of view, but also just to say a little bit about diet and nutrition and what Holland and Barrett have to offer in that space.
Yeah, two linked questions, and all offered by different industries as well. So one of the first things I'd say is, as much as we talk about lifestyle medicine being, indexing on the medicine part of it, actually it affects all of us, and therefore the employer-employee, not just healthcare setting, retail, insurance, financial sectors. So they're all kind of part of this bigger picture of keeping the entire population happy and healthy. So to the first point, David, with regards to, incentives through, insurance policies like wearables and trackers, there's actually been a really good study that was published by Vitality, as you mentioned. So they actually took the cohort of individuals who had Vitality Active Rewards and then measured them over 5 years. So they looked at first, second year and the engagement with it, and then compared it, 3-4 years, is it sustained? And what was really interesting, because initially you can maybe dismiss it as quite gimmicky, they did find that individuals who engaged with it actually stayed connected with that, and then actually ended up moving more. So to John's point about physical activity being a key indicator and something that enables better lifestyles, this actually showed, and it was published in a journal, that it continued in terms of sustained improvement in physical activity. And one of the reasons they felt that this was beneficial and sustained was in terms of how the incentive was framed. So, you had your Apple Watch, you had your rewards, or you have your verified in a park run. It was based on a loss framed incentive. So you would be losing money if you didn't engage with it. So that really used a lot of behavioral science technique to then embed it into the product that you were already buying. And then having that, connection and relatability because you're doing this on a whole bunch of people, either be it through your work organization or through their Vitality platform where you've got other members, then it kind of also gamified the whole engagement. So that was really effective. And so I'd encourage people to kind of maybe look into, is there something else that you can offer? And again, other insurance companies, other providers, other employee benefits organizations also have similar offering. So it's well worth looking into, what's out there, and then also testing it for yourself, because again, you might think that this is applicable to a certain cohort of individuals who kind of lean towards wearing wearables. Are there other people you're leaving out because you are looking at it purely from this kind of aspect? So that's one. Again, happy to pick up on any follow-up questions on that. The second thing you talked about in terms of diet and nutrition, and specifically with regards to what we're doing in Holland Barrett, the first thing I'd say is, as much as diet and nutrition is something that we take for granted, there's still a lot of education that needs to happen in terms of what good diet is, where can you get a balanced diet, micronutrients, making sure that you are getting and including 30 different plant-based fibers, reducing ultra-processed food. There's a whole host of things that you can do. And what we are trying to do at Holland Barrett is to, because we are on the high street, give people access to options. So from having food first and having lots of really good ingredients, dried food, for example, especially in the cost of living crisis, but also looking at vitamins and supplements as almost an insurance policy towards individuals who might not be able to access all of the food that they should be having in their diet on a regular basis. And then on top of that, we also have our store colleagues who are able to offer lifestyle advice. So you can either walk into a shop and ask them, how do I augment my diet? But also there's free 15-minute online consultations with our nutritionists who would be able to offer you that support as well. So, and on top of that, we're building some other digital technologies that would augment it in increasing education awareness and then empowering people with choices that are more accessible on the high street for them, so that it doesn't become something that is reliant on the National Health Service or any other provider, but something that a consumer can get their hands around directly. So that's the main thing for me in terms of diet and nutrition, in terms of education awareness, access, but also we're thinking about how do we make sure it's culturally competent, because when you look at the food pyramid or whatever's on the plate that's kind of education-wise we're offering individuals, it might not necessarily be translated to what an individual might normally see at their dinner table. So it is meeting people where they are and helping them make better choices for themselves.
Thank you very much. That's very, very insightful. I will have some comments about that from my own experiences of my diet, which will probably horrify you, but we'll get on to that a little bit later. As I want to move on now to Noel O'Kelly, who's a director at Spirit Healthcare, and we've talked so far about preventative healthcare, and we're talking in the context largely of people who don't have any medical conditions. But I'd like you to say something about your work at Spirit and what you're doing for people with long-term conditions like COPD, diabetes, some of which are lifestyle related.
Yeah.
How can what you do help them to continue to lead productive lives and reduce time off work, etc.?
Yeah, just a little bit about Spirit Health. Spirit Health is really, as I said, a healthcare company. We've got 55,000 patients in primary care. We also provide, called Empower, an education program that provides 30 different areas within the UK. And that looks at people who are newly diagnosed with diabetes, and they can access the service either through face-to-face or digitally, where they control it themselves, or a mixture of both. And then we also provide a platform called CliniTouch, which is our software platform which connects patients and carers to clinicians. You're quite right. We're really working within the secondary prevention field of those people who've already got a long-term condition. And what we're trying to do is have them monitored proactively by their clinicians, so they can empower the patients themselves to look after their conditions, but also interact when they need to get people on the right track. So quite rightly, you know, work with all long-term conditions, COPD, asthma, diabetes, heart failure, etc. The system we have has that patients or carers can input their symptoms and signs, both objective and subjective, as well as clinical observations. There's a scoring algorithm that works underneath that then rates patients as red, amber, green. So a clinician can monitor longitudinally a patient's well-being within their condition. But that also means then when they feel that somebody needs some assistance or help, they can interact with that patient either through texting through the app or video consultation, or actually bringing them into their clinic or going out to see them in their own home. So I think it's really important when we're looking at digital tools that we don't see them outside of the entirety, because I'm sure Dimple would say that human connection is really important. And we see this sometimes just with apps that are self-managed, is that patients or people or clients or whatever you want to call them, keeping them motivated to continue to use it can be difficult. And having that other person at the end of it who's monitoring that patient over a period of time really helps to engage the patient. Within our platform, we also have an education resource feature, which means that the clinician can then prescribe individual education to that patient around that patient's need. It might be about how to stop smoking, it might be around breathlessness, it might be around relaxation, and that can be multi-format. That can be in written, or it can be spoken word, or it can be video. And then and we're using this to its full extent in some of our rehabilitation programs. So we provide support to cardiorespiratory services, where we have in one area in Staffordshire, probably about 50% of the patients are finding that they're using the digital side rather than just the face-to-face, because it works better for their life. And we are getting similar outcomes of those patients. But it isn't the be end and end all of anything. This is a tool that connects patients and carers to clinicians with meaningful data. What that clinician decides to do with that data and how they support the patient is really important to the whole part of the cake, so to speak. We've looked at got lots of studies which have shown improvement in patient-reported outcome PROMs, outcome monitored symptoms, such as the CAT score. We've seen that improve with patients with COPD. We've seen reduction, 3 studies we've done now on patients with severe COPD that's reduced their admission rates by 2/3. So we can see a real benefit that patients get from this. But also when we ask the patients themselves, they feel more connected. They feel that they don't have to go. 90% of the people who were in one of our surveys said that they were able to be managed that way and didn't have to go to see their GP. And they're feeling more empowered to actually manage their own condition. But obviously, they also feel safe and secure that there's somewhere out there that's looking after that, keeping them on the right track as well. Sometimes with just the person-centric apps that just for person, sometimes it's hard to keep that motivation going for the patient to continue with their changes that they need to make and the modifications to their lifestyle.
Thanks very much for that, Noel. I'm now going to bring everyone onto the screen because I'm going to ask some additional questions, which to begin with will be based on my own experience and the things that I've discovered, which possibly may be unique to me, but I doubt it very much. So the first thing I want to ask you about are the role of wearables. And it's been my experience over the last 9 years. I've seen how wearable devices have become more and more sophisticated, as well as their mobile applications. So 9 years ago, I started with a device called the Jawbone Up, which basically measured your steps, but it also measured your sleep and gave you an opportunity to type in what food you ate, and it gave you your calorie outtake as well as your calorie intake. So the question I have to ask about wearables, they've become so sophisticated now that the devices that I use a I use a Fitbit Sense. I also have a device from China which measures all manner of things, including allegedly blood pressure, oxygen saturation, heart rate variability, and a whole range of things at a consumer price, around 45, 50 pounds. Now, to me, it seems a logical idea for employers to give these types of devices to their employees on a voluntary basis. I just wonder what your thoughts on that are, and what kind of issues to do with privacy and so on might be associated with this idea of the use of wearables as a employee benefit. I'm going to ask Suba first, because you were talking about this with the vitality study. Could I ask the others to put their mics on mute, because I'm hearing some background noise. So Suba, what do you think of giving employers giving their employees these mobile devices, these smartwatches and mobile applications?
Yeah, look, I mean, I think, as you said, the price points are coming down. The amount of information that people are getting, or the amount of data people are getting, doesn't necessarily mean it's information or insight that is actionable. So there's two parts to that. It is increasing. So I think there's definitely a role to it if you are offering it as a way of engaging people with the biofeedback to say, wear this, and then use that as a way of improving your activity levels. I think where that line becomes really dangerous is if you were to get the data back from whatever wearable that you've got, and then it feels too big brothery in terms of, what is the role between the employer and the employee. So if it is, and this is the whole thing, and the same thing with insurance or anybody who funds it, is unless you're very clear as to what you're going to do with that data, if it's purely for personal reasons to improve individuals' health, absolutely, use that. Again, it needs to be personalized, so not everybody would be keen to wearing a wearable. And if you're going to offer it as an employee benefit to one segment, what is the offer to the people who are not wanting to pick it up? Is there something equivalent alternative so that it's fair for everybody? So from an employer perspective, yes, but consider all these things. On the other hand, also get worried that everybody feels that the amount of information that's out there is calibrated for them, or that it's going to give them a specific insight that perhaps they might not have had otherwise, and all that refinement is not quite there yet. I know the likes of Apple Watch with the irregular heartbeat, that's again in its infancy, and then once you've got all of this information, what you need is a healthcare system that stood up to be able to pick up all of these individuals who might say, oh, my smartwatch said something, I need someone to look at me. So it kind of, it's all interconnected. So on one hand, it's a great idea, but on the other hand, every other part of the system needs to be able to pick it up when it goes wrong. And it also has to be entirely acceptable for the individual as a way of engaging with it. And I'll just end on my personal experience. I wear a Garmin and I like running. But I used to do it for peace, right? Like for me, it's nice to get out in nature and just go out there for a run. The minute I started quantifying everything, I focused on pace, not the peace element of it. So again, this is where it comes down to more is not more. We need to really tailor it to that individual, and technology is a tool, it's not a means to an end. So that's just my view.
Yeah, thanks, Suba. John, what do you think about this? In my experience with what works for me, I'm 73, so my running is very limited, but I do walk 5 miles every day. And what I've found is that if it's part of my daily routine and it fits in with my life and my situation at home, this is what works well for me. But of course, not everybody lives in the countryside and works for themselves. So. What's your thought on wearables and how they might be used by employers?
I think it's a fantastic tool, and I think it's one that needs to be utilized in the appropriate way. I think what Sue said is very wise in terms of the individual having the preference, because I think for some individuals, they love being able to monitor things. And I've personally found in my practice, whether it be on the NHS or when I was working in Australia, particularly dealing with my lifestyle patients, using wearable technology in order to monitor and help people achieve their goals in that sense, gave people a real sense of purpose in that sense, and actually enjoyed hitting those goals. Now, the one thing you don't want that to then go on to is, again, kind of what Suba alluded to, this feeling of guilt of, oh, I'm not going quick enough, I'm not doing enough steps. This is becoming more of a negative thing as opposed to a positive thing. And that's one thing, again, in behavioral change management, when we're talking about lifestyle medicine, that's one of the things we really emphasize, positive change as opposed to it being a chore or being something that you need to do. So in terms of monitoring health and we're looking at these things, I think for some individuals, it's really, really helpful. I know personally, I very much enjoy being able to monitor data, especially step counts and things. Being a GP who's working 7 till 7 most days, being able to get the steps in is sometimes tricky for me. So I find actually motivating myself by getting up a bit earlier, going for a walk, going for a run, getting those steps in and having that data there and knowing I achieved that not only gives me the sense of achievement that I've done that, but also gives me all the positive effects that exercise does. So I think it has real potential. And there are lots of different categories where using wearables can come in. I think from a kind of business point of view, obviously you're looking at general health optimization, but it has to be the individual's preference. And you don't want that then to translate into them having feelings of guilt around it. And it's certainly something that we considered when we ran this project, the walking project that I mentioned earlier. There were individuals at the surgery who weren't as keen as being active. So we made sure instead of it being an individual versus individual competition, we made it a group competition so that individuals didn't feel like they were being targeted for their lack of activity. And also it means that you're not kind of illustrating certain unhealthy habits in individuals who some might find, quite embarrassing or things that they don't really want to talk about. I think ultimately, if we're providing this, or if you're offering this to your employees, it's an option for them that they can use to better their health. If they're not keen on it, then that's fine. But if they are motivated by those things and they find them useful, then I think it can be a really important tool.
Yeah, okay, thank you, John. Dimple, now I just want to share my experiences on the psychological aspects of this, because when I started 9 years ago, I was living on my own in a flat, and so I wasn't involved in a long-term relationship. I could really do what I wanted to do when I wanted to do it. After about 2 years of doing this, I met my partner. And eventually moved in with her. And so she has a different lifestyle routine, which involves eating late in the evening. And all of the things that I'd learned not to do while I was living on my own, suddenly in accommodating someone else in a relationship, I found that I had to adjust my behavior. And the net result was that I put a good deal of the weight that I'd lost on again, because she likes a glass of wine and some food. And it wasn't until COVID struck that I thought I should do something about it again. So I did, without disrupting too much the domestic bliss that we have here, adjust the amount that I ate. And was a bit more careful about what I ate, when I ate, and more fastidious about hydration. So what would you say about relationships and their role in how people use technology to manage their health?
Yeah, really good point by John and Suba and you, David. So with these wearable technologies, I mean, data and information can be valuable determinant of health and a starting point for behavioral change. But extrinsic motivation, so data as an extrinsic motivation, there can be a plateau effect. So it's really important to really kind of motivate people from an intrinsic point of view. So data only takes you so far, and it's really important to bring out the meaning and what that means for you in your life with your family and your purpose, and also the way your urban environment and work environments and family environments interact with that. So with the intrinsic data, it's important to also align it with the right incentives. And after a while, there is a plateau effect. So people do get used to it and almost like switch off. So with the relationship, I've had so many patients come to me where, you know, looking at variables and data, wearables and data and blood tests and different investigations. And the big thing is what that means to them, and really the relationship can mediate sustainable behavioral change.
Yeah, thank you for that. That's very insightful. Yeah, I will go along with that. It's all about personalization. Every individual is different. Every individual is motivated by different things, and everyone has different circumstances. And in my case, my life circumstances changed after a couple of years, and that totally changed. I still insisted on doing my 5 miles every day. So it wasn't that I wasn't doing the exercise, but it did teach me a lot about the importance of diet and other things, sleep and hydration. Noel, you're involved in the use of devices and technology that measures people's vital signs. What do you think about the idea of employers getting involved in providing their staff with tools to help them manage their personal health?
It's interesting. I've been listening to what everybody said, and when I was a associate medical director for a large community and mental health trust, we had a lifestyle app that we had for our staff. That we got very poor engagement for the reason like Suva and John and probably Dib would agree. People thought they were looking. They didn't see it as a positive thing. They thought it's related to my productivity. Why are they doing it? There was a skepticism. So I think if you're looking at lifestyle management using digital tech and the data, people are always worried around where that data is going and how it'll be used. So I think if you are an employer and you're looking at doing it, you have to have some kind of separation between that data, who's looking at that and how that's feeding back to the person, rather than they feel it's going straight to their employer and they're saying, well, you didn't do your 10,000 steps today, and that's why you're not as productive as you should have been. It's a real kind of issue that needs to be addressed. Doesn't mean to say that at larger scale, when you're looking at anonymized data, you can't look at the impact of using a lifestyle management digital program and anonymize that data, and the company as a whole can see the benefits of it. I think you can actually address it that way. It's also interesting looking at the motivations that people have around their lifestyle, because as you said, David, different strokes for different folks. Some people will embrace it, some won't. One of the interesting things that we found, we did some research recently looking at the attitude that patients had towards the tech that we were using. And not surprisingly, we found that if we had a very engaged clinical team who thought it was brilliant, who could sell it to the patients, guess what? The patients loved it. Whereas if you had ones who were a bit lukewarm about it, the patients had a negative feeling towards it as well. So the way it is presented is really important, the way it is marketed, and the way people can see the benefits for themselves, meaningful benefits for them. There's also, you've got to deal with the fear that people have around technology, which is a little bit about the big brother stuff, but it's also their ability to take on board what that data themselves is telling them and how they can use it in a positive feedback as well. So I think there are huge scopes to be able to use it. It's just making sure that the model in which you use it fulfills all those tick boxes of getting people engaged to see the benefit, the way you can monitor it, the separation of that between the patient themselves and actually the employer. All these things need to be taken into account.
Yes, Suba.
I was just going to add to what you said, Noel, because I think one of the issues as well is to taking this data, raw data, and then refining it to say this is what it means. The place where we all kind of are falling down is that where's the test data? Is it representative of the entire population? It's only recently that we actually turned around and said, well, you know, body mass index, which in itself is a flawed kind of like construct, there has to be different reference ranges for people of different ethnicity, right? So this is where I think, you know, it's good as a tool, as a motivation, but the actual validity of the insight that you gain in terms of your health risk still needs a lot more work to be done. And so underpinning all of that is trust, so that we have more people using and adding to the data set, so that then whatever comes out of it in terms of an algorithm, it is actually equally applicable to, say, all of us in this session as well. So again, even if people are skeptical, actually there might be a benefit in getting involved, so that you can increase the quality and the heterogeneity of the data that we all will be eventually reliant on.
Yes, yes, Noel.
Yeah, no, I totally agree. I think the more data you have, the better you're able to find out what does that actually mean. And this is part of the issue around artificial intelligence, which you can use. If you're looking at something which is very binary, fair play. But if you're looking at a composite picture of a patient with multiple comorbidities, different social circumstances, gender, living conditions, etc., it becomes more complicated. But I really do think further down the road, as we get more engagement, then we'll start to see those trends appearing, and then we can work them out.
Yeah, I think that's very important, because with the adoption of wearables, it's a very much a personal thing, and there's a danger if you are collecting a lot of data that data will be skewed towards the people who are enthusiastic about using wearables, like myself. Yeah. So the other question about wearable devices that occurs to me is to do with the medical certification as medical devices, because the devices that are coming onto the market now, even though they are not medically certified, a lot of them, if you look at the data they collect, are pretty close to medical grade devices. But there seems to me to be a reluctance among the developers of applications that use this data to actually provide any prescriptive advice. Partly because I think it's a very personal thing, but I think more likely is that they're frightened of litigation. That if you're taking data from a device and you say you need to exercise more, and that person goes out and had a heart attack because that was inappropriate for them, then the manufacturers of the wearable device are in for some litigation. So just talking about gamification and motivation, you know, how have you got any tips for employers or even employees on how they can gamify themselves? Because that's what I did to begin with. You know, I said in the day it was 10,000 steps, do 10,000 steps. That was what my gamification was. My challenge was every day to do 10,000 steps. And once I got into that daily routine, then I became obsessed with not missing a single day. You kind of touched on it, John, with what you said. So, and Dimple also mentioned the difference between intrinsic motivation, which is enjoying the challenge, and extrinsic motivation, which is partly what Vitality Life doing, you know, giving a smartwatch if you do this, giving a reward if you do that. So what do you think is most effective for behavioural change, Dimple?
I think it's many things. So the first thing is that people have to understand they have control, autonomy. There needs to be connection and relatedness and meaning, and they need to be capability. They need to know how and what to do, and there needs to be a safe. Keep mentioning psychological and physical safety. They need to know that they're in a safe environment, so there's not going to be shame if they don't, you know, do what they need to do, or, you know, they don't hit those targets, and they need to be able to feel the environment is supportive of behavioral change. So that I think those are the really big factors, supported by behavioral science as well. And we all know that our urban environments don't necessarily support behavior in the healthy way, but as work is being done with urban planners, which takes decades, and also government organizations, I think if people, individuals understand the way they interact with the urban environment or their work environment, and the awareness of that can support sustainable behavioral change. And things are context specific and it's all dynamic. So something that's important, at one point in your life may not be, but I think at all points of behavior and sustainable behavior change are those three factors, really: autonomy, capability, relatedness, and employers really providing the environment. So not just having that sort of tokenistic policy, that one sort of annual day out where you're healthy, just not just the fruit bowl that's just left there, but things that are really supporting a culture every single day. So for instance, the way you structure team meetings, is it inclusive? Is it healthy? Is everyone heard? To the way that you embed these cultural sort of supportive practices to support things every single day.
Thank you, Dimple. John, would you like to say a bit about motivation and also social prescribing, because that may be a new concept to a lot of people. What is social prescribing?
Yeah, because I wouldn't mind just jumping on the last point, just very briefly.
Please.
In the sense that I think there are some really key aspects of how we can help employees in making these changes. I think one of the first steps is working out where an individual's at that time and what things are specific to them that are going to make the changes and that are going to provide the benefit. Because ultimately we talk about some of these targets, especially with some of these wearables like 10,000 steps or number of hours of sleep a night or number of hours in deep sleep, which we can measure through certain devices. These things are all good and well, but actually having more precise information on how an individual can really benefit themselves in a way that's actually suited to them. So as an example, it's no good me saying to an individual, look, you need to exercise more. You need to start running 3 times a week. Come back and see me in a week's time and we'll see how that's gone. No idea if this person likes running. I know if this person's run before. We need to know their starting point. And actually, if we've got an individual, which I see commonly in my clinic, who is doing no exercise, maybe doing 2,000, 3,000 steps a day, that needs to be a graduated increase so that not to, especially from a physical activity point of view, burn them out, but also to extent where they actually feel it's achievable and realistic and they can fit it into their day. So the finding out where an individual's at, I think is really, really key. Educating around that on changes which will make a difference to that individual, and then having accountability. We know accountability is the biggest factor in terms of sticking to diet, sticking to exercise routines, having behavior change. That is what makes a difference, having that accountability. So I think that's really key. Switching lanes slightly and talking about social prescribing, that's a great thing that we can offer in the NHS. So as an individual GP, I get 10 minutes per patient, and some have got some very complex needs. One of the things we've talked about today is chronic disease background management and just generally looking after yourself. And that's something that I'd love to speak to my patients on an individual level for an hour at a time, but there just isn't the ability to do that. With social prescribing, we've got individuals at the surgery who are actually trained in knowing local support services. They can link patients in with health coaches who've got an hour for appointments, individuals who are able to counsel on lifestyle, healthy eating, being active, all these positive things. But they can also give advice, as in not health coaches, but other individuals on finances or other aspects of their life which are causing stress. And we know that stress and anxiety are big, big drivers to lifestyle changes, which are often suboptimal. So if we can enhance that through other individuals in the community, often better suited to manage these issues than I am as a GP, but often patients will come to me with those kind of asking those questions, trying to get those answers. and I can direct to someone like a social prescriber who can direct in the right path or find the path themselves in terms of how to help that patient, then that can make a huge difference to the overall picture and enable people to make changes.
So, but would that include Weight Watchers, for example, where you could prescribe someone going to Weight Watchers? Because they, I mean, they have. I've been to Weight Watchers a few times, many years ago. Don't need to go now, but I really quite like their approach because it was non-judgmental. You were with a group of people who in the same situation as you, and a bit like Alcoholics Anonymous, I suppose. You were with a group of people who had a common problem that you could work together to solve. Yes,
100%. You've highlighted there, David, actually a really good point in that group consultations are something that the British Society of Lifestyle Medicine are really driving for exactly the reasons you've just outlined. And I'm looking to do that in my surgery at the moment, having group consultations around diabetes and other chronic diseases for the exact reasons you say. And we know that, again, as going back to my point about the accountability is the thing that makes the difference. And Weight Watchers gives that group accountability, that support, that kind of model for looking after one another and being in it together, and it makes huge differences. We've seen great case studies all up and down the country of individual NHS practices who've done group consultations following a similar model to Weight Watchers, but obviously for a specific condition or disease, and some of the results have been amazing, and I hope that's something that continues going forward.
No, that's wonderful. Well, we are coming towards the end of our session. I'm rather disappointed that even though we've got a reasonable number of people watching us, nobody's typed in any questions yet. We've had a comment to say very insightful, which I'm very pleased about. But in the 3 or 4 minutes that we've got, could I ask each of you just to give your thoughts on what we can expect in the future, or if there's just one thing an employer can do to help with the well-being of their staff? And I will start with you, Noel.
Oh, thanks for starting with
Put
me
you on
that
the
one.
spot.
You know, one of the things is lifestyle changes don't happen overnight. They take a period of time. You know, you have your successful habits and your unsuccessful habits. Do the same thing over again and again for 21 days, probably breaks that cycle a bit. It's actually for employers, it's about supporting and truly understanding what they can do, what the issues are for their employees, and supporting them rather than being a big brother. So setting up some way that they can engage them that somehow is semi-detached from their role as an employer, but gives them an added value that they can see the benefit from, and actually being able to market that to their employees would be quite useful.
Super.
Brilliant question. I would probably say 3 things. So the first one is, you know, you spend 8 hours at work. So, or at least, you know, John just said he's 7 to 7. So that's 12 hours of work. So it is not an insignificant amount of time. There's a duty of care that employers have to their people. And so I would start with saying, is it meaningful work? You know, are individuals given autonomy, belonging, contribution at the place of work? So that is entirely within the gift of employers to ensure that that kind of need is fulfilled. The second thing I would say is well-being is not just for Christmas or, you know, for people function. Well-being is everybody's responsibility. So how you show up and what your policies are, being visible in terms of leadership and walking the walk rather than just talking the talk is fundamental. And the third thing really is that if you're looking at technology or anything in the digital space, it's fast evolving. The needs of, we've got 5 generations of individuals working in offices right now, in any setting. So you need to kind of understand where people are, what is kind of common for them. So we might assume that not everybody engages with technology based on what we think, but actually all of this kind of changes. Look at what's happening on Instagram, TikTok. Keep your finger on the pulse, because you can't have a static well-being policy. It's a business policy and it's dynamic. So meet people where they are. So 3 things.
Thank you. John?
I'll keep mine brief. So I'd just say active breaks. I think having active breaks makes a huge difference. I'm obviously biased because I've got my activity hat on, But I would say it makes a huge difference to productivity. As even as a GP surgery, as a group of GPs, we barely have minutes at all to spare, but we make a point of going on a 10-minute walk once a day in the middle of our day when we're feeling a bit lethargic. And I can honestly say, from a productivity point of view, it makes a huge difference. So it's not a case of enforcing it on employees. It's not a case of making them feel guilty about it, but make people feel that they have the ability, or they can go on active breaks if they would like to do so, because you'll see the benefits. There's a reason why Google and all these companies have a gym in their building.
Okay, thank you. And finally, Dimple.
I would say many levels: environment, culture, people. Those are the three main things. And ask your people. They have the insights. Just create the environment that's physically healthy and psychologically safe, and ask your team. They will provide the answers, and it's a dynamic thing. It will really depend from on the group, what's happening, and action research methodologies, coaching, and asking people solutions with and for your people.
Okay, thank you very much. And thank you for all those people who have now typed in comments. They're much appreciated. They show that at least we have got some people watching us, and they are appreciative of what we're saying. And I do appreciate your time as well. I'm sorry to draw this to a close. I'm sure we could talk about this for quite some time, but I'd like to thank all of our participants for today. And I hope you all have a very happy and healthy Christmas. So from me and from all our panelists, goodbye. Bye-bye.